Hi, everyone. Michigan Attorney General Dana Nessel here. Now, by this time, I'm sure you know that as Attorney General, one of my responsibilities is to represent our state and join with other attorneys general from around our nation to support or oppose actions being taken at the federal level. I wanted to take a moment to share with you one of the recent multi-state efforts I've joined. My colleagues and I reached out to the United States Department of Health and Human Services today on an issue I know to be of great importance to the people of Michigan, especially as we continue to work together to slow the spread of COVID-19. Here's why. There's a part of the Affordable Care Act called Section 1557, which specifically prohibits discrimination on the basis of race, color, national origin, sex, disability, and age. Now, last summer, HHS decided to propose a new rule for Section 1557, cleverly called the Non-Discrimination in Health and Health Education Programs and Activities Rule. But after my colleagues and I read it, we realized that this proposal would do the exact opposite of what Section 1557 intended. And we discovered that it would weaken those anti-discrimination protections for women, LGBTQ individuals with limited English proficiency, and individuals with disabilities by undermining critical legal protections that guarantee health care as a right. We explained these concerns to the federal government last year and asked them to reconsider and withdraw this proposal due to its negative effect on millions of people across this country and in our state. But they didn't listen. Because right now, as COVID-19 wreaks havoc in our communities and across this nation, HHS is actively working to finalize this rule. And at a time when we're reminded most of why barriers to healthcare shouldn't exist, the federal government is showing a blatant disregard for it. Although my colleagues and I do not agree with the finalization of this rule at all, I am baffled at the attempt to finalize it right now in the midst of this crisis. This couldn't happen at a worse time for our residents. The data shows that this pandemic is exacerbating the very healthcare disparities that the ACA was designed to help mitigate. But what we know for sure about COVID-19 is that it doesn't discriminate, and the federal government should want to do everything it can to ensure it doesn't restrict life-saving care or create unnecessary administrative burdens and confusion for state agencies, healthcare providers, and for patients. Remember, we're all in this together, and this virus, this vicious, voracious killing machine, is the one enemy we can and must be committed to fighting against. COVID-19 does not discriminate against who it hurts. The government shouldn't discriminate against who it helps.